Our charge and our challenge, if you will, what we're putting at the feet of those who might be listening, is be a hero yourself and try to help yourself, your family, and the rest of the community in which we all share drive that pass along down to zero.
This is Heroes for Zero, a Contec podcast. Very few times in history does the world change by the minute. Today is March 17th, 2020. You may be listening to this tomorrow, or weeks and even months from now. So to help understand the context of our conversation today, here are the facts as published this morning by the WHO. Globally, there are 167,000 confirmed cases, including 13,000 confirmed cases that are new overnight, and 6,600 deaths in the COVID-19 pandemic. Just 6 days ago, the world was shocked when the NBA suspended their season after a player tested positive for COVID-19. The NHL, Major League Baseball, Major League Soccer, NASCAR, and countless others have since followed suit. What was 1 week ago unimaginable has now become a part of our reality. Whether sports or schools, shops and restaurants, the world has quickly been introduced to the words social distancing. But why is social distancing so important?
On day one, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
If you watched the 2011 movie Contagion about a worldwide pandemic of a new virus, then you've heard the term R-naught. Now, that term isn't something a scriptwriter made up in Hollywood. It represents an important concept in epidemiology and is a crucial part of the public health planning during an outbreak like the current COVID-19. Scientists use R-naught to describe the intensity of an infectious disease. R-naught estimates have been an important part of characterizing pandemics and outbreaks, including the 2003 SARS pandemic, the 2009 H1N1 influenza pandemic, and the 2014 Ebola epidemic in West Africa. So we're joined now by Mark Weinsick, Contec's lead microbiologist. Mark, can you explain what R-naught is?
Thank you, Daniel. So R-naught, that's how you say it. When you see it written, it's actually a capital little R with a subscript little 0 after it. And so another word for zero is naught. And this concept or mathematical calculation is actually used to model pandemics, as you said. It actually started back in the 50s when they were modeling malaria outbreaks and trying to understand what is the likelihood that an infectious agent is going to spread throughout a community and how quickly that spread might occur. So it turns out it is, again, a fairly complicated mathematical calculation that's kind of done after the fact. So the R-naughts that we know or have been calculated for this virus, which is officially called the SARS-CoV-2 virus and causes the COVID-19 disease, has been calculated based on the original outbreak calculations out of Wuhan, China. And it was calculated to be 2.2. So what does that mean? It's actually a range, but we'll call it just 2.2 so we can just focus on that. So what does that mean? That means that for every 1 person that's infected with this virus, there is likely on average 2.2 people that will catch that virus from that 1 person. So there's no 0.2 people. So let's just say for every 1 person, 2 people catch it.
And just for comparison's sake, I've got a couple of other outbreaks with their R-naught number. For instance, measles has an R-naught number of 18, mumps 10, and Ebola 2.
That's correct. And so these viruses, these diseases have had enough calculations done on them that they have been able to calculate kind of average R-naughts, which is what you're quoting there. Now, an R-naught's a function of many different things. Part of it is just how well can that virus be transmitted from one person to the next. But that transmission is related to not only the biology of the virus, but the sociology of the host. So it turns out we can't change this virus. Right now, we don't even have a vaccine to prevent you from catching the COVID-19 disease, but we can have an impact on the actual R-naught number because we can reduce its ability to transmit by the way we behave.
And that's where we get to social distancing. So we're joined now by Matt Shearing, Contec's Chief Marketing Officer and a longtime healthcare industry veteran. Matt, can you talk a little bit about social distancing? When I was talking with you last week, that was actually the first time I had heard that phrase given.
Sure, Daniel. Good to be with you and Mark. In a nutshell, it means keeping to yourself, limiting your exposure to other human beings. So that's no easy feat, given how much each of us relies on social interaction in our day-to-day lives. Of course, social media has played a role in many of our lives for the past, I'll call it 15 to 20 years. But for those of us who are used to going to the grocery store or showing up at work, water cooler talk, as some of us have called it in the past, limiting that exposure is apparently one of the key elements to reducing that R-naught and keeping ourselves and our families and our communities safe.
And again, if you're listening to this at some point in the future, the situation may be completely different. But right now, even just this week, our own company has asked employees to work from home as a effort to break the chains of transmission and stop the spread of this. What are some of the ways that people can break that chain, that they can stop the spread?
So I'll just give you a quick personal example. This past Sunday evening, my wife and I were supposed to go out with friends of ours. What we decided to do instead was get on FaceTime, grab some bottles of tequila, and did shots with one another over video. Now, you don't have to drink to get through COVID-19, but we were really looking forward to sharing a tasty beverage with one another at one of our favorite local restaurants. So rather than do that, rather than expose one another and our respective families, we simply shared a drink over FaceTime. That's one easy way.
So there are some people who actually cannot practice social distancing. I'm thinking particularly of our healthcare workers who are on the front lines of this right now, and even the folks who have been given the mission to keep surfaces and spaces clean. Their roles have become so much more important right now. And I want to play a quote from Dr. Tedros, the WHO Director General, discussing these healthcare workers.
I want to start today by acknowledging that even though COVID-19 has captured the world's attention, there are still many other health issues people continue to face every single day, and that WHO is continuing to work on. Babies are still being born. Essential surgery is continuing. People still need emergency care after road traffic crashes. People still need treatment for cancer, diabetes, HIV, malaria, and many other diseases. And for all of this, we need health workers. Today, I want to send a personal and sincere thank you to every health worker around the world, especially nurses and midwives, who we are celebrating this year through the International Year of the Nurse and the Midwife. You do a heroic job. We know that this crisis is putting a huge burden on you and your families. We know you're stretched to the limit. You have our admiration, our respect, and our commitment to doing everything we can to keep you safe and enable you to do your job.
That quote was given just a few days ago by the WHO Director General, And it's amazing how fast the world has changed to where last week, I would say the average person was content to let healthcare workers take care of the COVID crisis. But this week, we are all being called on to act, to break those chains of transmission. And Matt, would you speak a little bit about, the name of this podcast is Heroes for Zero. And typically when we think about being a hero for zero, we're talking about the healthcare worker. But in today's new world, everyone can be a hero for zero. Can you explain a little bit about what Heroes for Zero is and how people can do their part?
Sure. Thanks, Daniel. There are really two parts. And what a wonderful sentiment that you just expressed. Thanks for sharing that quote. Because so often we overlook the efforts of those who are charged with keeping so many of us safe as we head out into our respective communities. These folks are legitimate hidden heroes, people that are behind the scenes, even though their job is frontline cleaning and hygiene. But to your point about everybody having an opportunity to be a hero, that really means that each of us has a part to play in reducing the rate of infection and its pass along by washing our hands, by maintaining and practicing good social distancing, by sharing our experiences with others and encouraging them to fight the good fight, so to speak, to stay strong and continue to practice healthful practices for themselves and their families. You too can be a hero of sorts. The zero part actually speaks to what Mark was discussing at the beginning of this podcast, which is how do we reduce that R-naught from 2.2 back down to zero? There are certain behaviors that we can exhibit, not least of which is social distancing. And while we may not be able to get it all the way down to zero, we can sure try. So our charge and our challenge, if you will, what we're putting at the feet of those who might be listening is be a hero yourself and try to help yourself, your family, and the rest of the community in which we all share, drive that pass along down to zero.
That is exactly part of how R-naught starts at R-naught. So we talked at the beginning about there's really one big line is an R-naught greater than 1. And again, R-naught stands for Basic Reproduction Number, and it's a function of many different aspects of how a disease actually can spread through a population. And so if we have an R-naught greater than 1, then that disease, that pathogen can survive. It's an ongoing spread. We've got to at least get below 1, which means one person that's infected can only infect one other person. Now that 1 still is sustainable. That's still not where the goal is. We've got to get less than 1. And you can even imagine that at some point you're getting down to it takes 10 people to actually infect 1. So that would be an R-naught of 0.1. And that is very unlikely at that point that virus can actually survive in that population. So once you get below R-naught of 1, you start heading to the point where the virus itself cannot survive in that population, and eventually we'll have an R-naught of 0.
So let's talk about a little bit about the best way to prevent this illness from being transferred. There's a couple of things that the WHO has suggested and the CDC in the United States. And so I'll read these off, and then Mark and Matt, if there's anything that you want to contribute, clean your hands regularly with an alcohol-based rub or soap and water. Cover your mouth and nose with your elbow if you cough or sneeze. Stay home if you're sick. Avoid unnecessary travel and large social gatherings. And comply with the advice of your local or national health authority. Anything else that you guys would like to contribute?
I think that a lot of this is really about changing habits. And I'd like to speak, I'll give another personal anecdote. So our 18-year-old was sent home from her freshman year at Syracuse University just a few days ago. And we thought she'd be going back after 1 extra week away from school. So spring break this week, and then they said an extra week off so we can thoroughly clean the university. Well, we got an email yesterday that suggested, we got an email yesterday that said no more classes. So it'll be all online learning for the rest of the semester. See you next September. She wanted to go out last night and commiserate with her friends. How do you practice social distancing? How do you self-quarantine if not every member of your household is on board with the program? So we had a long talk, and while we did let her go out last evening, we made it very clear. Here's a new habit we're all going to practice. The last thing you do before you leave this house is wash your hands for 20 seconds or more. And the first thing you do when you walk back into this house is wash your hands for 20 seconds or more. So it's best, of course, if everybody is practicing the same good habits, the same social distancing, the same sheltering in place type of activity. But if not, I would encourage everybody to be sure to get on the same page with new habits.
And we're likely to see, it's a new world today. We're likely to see new habits, new actions, new ways of going about life, because just 2 days ago, the CDC recommended canceling all events of 50 or more people for the next 8 weeks. So it'll be really interesting to, see the resolve. And another quote from the WHO is, "The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of our solidarity. Because if we're going to be heroes for zero, we all have a part to play in that."
Again, you talked about habits, and so we are creatures of habits. One of those great examples that I was reading a lot more about the habit of touching your face, and that is something so innate to human beings that they even know that babies in the womb touch their face. I mean, it is something that cats do, dogs do, humans do, and it has to do with actually how it calms you down. And so it's one of those things of, you're not going to just not touch your face. You can't break a habit that way. But can you do something else with your hands, like crossing them? Can you do something other than going out for voluntary, that is considered not required, not necessary? You're not a first responder, you're not healthcare, you're not manufacturing articles that are used in healthcare, and you've got to actually be on the job. Then don't go out. Don't take the idea that I'm going to use my habits of washing my hands, these new learned habits of not touching my face. The easiest way is to just distance yourself and not be around folks. And so when we talk about how do we do that? Well, humans have demonstrated great resiliency through famine, pestilence, and war. And we can call this one pestilence for sure. But we've made it through this before, and frankly done it with much less resources and much less scientific knowledge. And we've still been able to move forward as a society and as a one human race. And so we will do that here. It is, again, a new challenge and not one that we've faced in quite a long time. But again, humans have not made it this far for this to be a long-term issue that we cannot overcome. Even if this becomes part of a cold or a flu virus that we have to deal with year to year, we've dealt with that with a very deadly influenza outbreaks, and we've still been able to grow and prosper as a nation and as a planet.
I'd like to close by saying, just because we are social distancing, just because we are keeping to ourselves, doesn't mean that we should isolate ourselves completely. I love the sentiments that I've read, that we're in this together, we'll get through this together. The telephone is a wonderful invention, and whether you choose to use it as a FaceTime tool or just to hear another person's voice, I want to encourage anybody who's listening to me now to make the time to reach out to others, reach out to friends and family, and do it through vehicles beyond social media, right? Beyond the written word. Listen to someone else's voice. Try to look at somebody else's face. Try to practice empathy and seek empathy from others, because it's only through the sharing of this experience, even if we can't share the same spaces with one another, that I think we'll truly get through this thing together.
Well, thank you, Mark and Matt, for joining us today, and thank you for listening to Heroes for Zero. I'd also like to thank the WHO, the CDC, Michigan Public Health, and the University of Illinois Chicago College of Medicine for some of the information that we shared today. For the latest information on COVID-19, follow the WHO and CDC online. That's at WHO and at CDC.gov, as well as you can follow at Contec Inc. to stay connected on our various social channels. You can subscribe to Heroes for Zero on your favorite podcast platform. We're available on Apple, Spotify, Google Play, and more to learn when our next episode will be published. Thanks for listening.